We begin tonight, though, with developments in the deadly viral outbreak on a cruise ship off the coast of Cape Verde in the Atlantic. Spain has now agreed it will receive that cruise ship. The ship has been stuck for several days while authorities scramble to contain the virus and decide what to do with the 150 passengers. CBC's Mark Carcasole has been following this story, joins me now from Toronto. So, Mark, what is the latest?
Well, Sarah, it looks like the nightmare, or at least this chapter of the nightmare for those 150 people aboard this ship is soon to be over, mainly for those who are not infected and have just been stuck on the ship. There's still obviously much concern for those who are sick. But as you mentioned, Spain confirming a little earlier today, just maybe over an hour ago through its health ministry, that they will indeed be bringing this ship into the Canary Islands and receiving it there. Here's a statement from the health ministry. They write, quote, "The World Health Organization has explained that Cape Verde is unable to carry out this operation. The Canary Islands are the closest location with the necessary capabilities. Spain has a moral and legal obligation to assist these people, among whom are also several Spanish citizens. Spanish medical teams will be examining, treating all the passengers and crew aboard the ship, and then when it is safe, sending them back to their home countries." The WHO will also be working with medical experts in the various territories where the ship stopped over the course of its voyage, which started in Argentina in March, and let passengers off.
Mark, so the thing is, though, I mean, you mentioned the World Health Organization. What we have heard from the WHO is that this virus could be spreading between humans, like human to human. And so what concerns might be around that as you allow those who are on board the ship to disembark?
Yeah, that is the major concern right now, Sarah, and that is why the World Health Organization is sending teams to all the different places where people disembarked over time. It is, as we discussed yesterday, rare to see human-to-human transmission of the hantavirus. However, there is a specific version of it that circulates particularly in South America and, yes, in Argentina, where the cruise began, called the Andes virus. And that is one that tends to, a little more than the others, spread more proficiently from human to human. And that's the concern of the World Health Organization. They're still testing, but it is their working assumption at this point that this is the form of hantavirus they're working with. Here's Dr. Maria Van Kerkhoff. She's the WHO's Director of Epidemic and Pandemic Preparedness and Prevention.
The initial patient, the initial case, and his wife, they joined the boat in Argentina. And with the timing of the incubation period of hantavirus, which can be anywhere from 1 to 6 weeks, our assumption is that they were infected off the ship. We do believe that there may be some human-to-human transmission that's happening among the really close contacts, the husband and wife, people who've shared cabins, etc.
Adding to all this, the WHO says inspections have been completed and they've been informed that there were no rats or rat nests or droppings or urine or anything to do with rats on board the ship itself. So it sounds as though a lot of this could theoretically, as part of their working assumption, be part of human-to-human contact. Regardless of all that, though, they do say that the risk to the wider public in these various places where people disembarked is still considered low.
Okay, thanks, Mark.